important
This
scenario.
conference will now be recorded.
Very good question. Very common question. So the station will say 95 years old, 95 years old, Andrew Thompson, okay, 95 years old, Andrew Thompson was found wandering in the park, wandering in the park. He was brought, he doesn't know anything about his own details, like his name, his date of birth. This is the question. So he was found wandering in the park. In brackets, it is like dementia station. This is like what? Dementia station. The question said, please listen carefully to the question. Talk to the patient. Do the relevant examination or do many mental state examination. And at 6-minute bell, discuss management with the examiner. Again, 90 years old, was found wandering in the park, not knowing where to go. That's the meaning of wandering in the park. He doesn't know anything about himself. What is the task? Talk to the patient. Do many mental state examination. And at 6-minute bell, discuss management with the examiner. Are you clear? Okay. Guys, reading the task is important in any station. So in this station, I know that I will have to perform many mental state examination. And I know that at 6-minute bell, I'll discuss management with Salah al Nabi. Any station, we need history, we need examination, we need management. You know the structure? History, examination, management. So this is like any station. This is like any station. History, examination, management. Okay. In the history, it will be only 5 questions. So the history in this case will be only what? 5 questions. That's it. That's it. And the 5 questions, in fact, is for me to prove that this patient is confused or this patient actually he's not knowing what's happening. And that's it. 5 questions? Yes, please, guys. 5 questions, because I need to start as early as possible. What? Many mental state examination. Clear? What do you mean, Dr. Mo? I mean that the question is confusion, but not the medicine cases confusion. Not the medicine cases that we know in the course, confusion. It is psychiatry case of confusion. So what are the questions? The questions are 5. Which basically to confirm he is confused. So what are the questions? 5 questions. To confirm what? He is confused. Yeah, Dr. Mo. They told you that he's confused. They told you he's wandering in the park, but you are the doctor. It's your job actually to confirm it. That's what about the 5 questions. So the 5 questions, simple. I called them the cognition questions. The 5 questions are called the cognition question. Can you please confirm your full name? That's one question. Dr. Mo, it's a confirming identity. Yeah, it's one of the questions. Can you please confirm your date of birth? Do you know where we are? Do you know who brought you here? Do you know where you are? Do you know who brought you here? Can you please confirm your address? How many questions? And that's it. This is my history. This is my history, yes. This is my history. 5 questions. That's it. That's it. Then I will start with what? With what?
Examination.
The many mental state examination. Is anyone lost? So this is not any allergy, yeah, brother. Allergy, yeah, brother. He's found wandering in the park. What kind of allergy? Any family history? Family history? You don't. So I only ask 5 questions, which I call them the cognition question. Okay. I will add a small piece because all of you going to the exam. You know the confusion stations, the medicine confusion station. A patient is confused and you approach the patient, chest infection or UTI. You know this kind of medicine station. Whenever I look at scripts in order to see what's happening, because you should all the time read what everybody else doing in order to be different. Everybody start the station with medicine. What do you mean? In medicine station, if the case is confusion, if it is a case of chest infection, I will start with the 5. So even though the question said 65 years old in the A&E, confused, talk to him. Then everybody start any chest infection. Any no. You've been told he's confused, but it's your job to confirm he is in a medicine station, not psychiatric. So you still need to start with that. So please add them to any confusion station. So any confusion station, medicine. The cause is medicine. You know what I'm talking in the course. You know what I'm talking about. The cause is medicine, yeah? I mean, chest infection, ear infection. You still must start by asking the 5 questions. Do you know where you are? Can you please confirm your full name? Can you please confirm your date of birth? Do you know where you are? Do you know what you can you please confirm your address? Even if the station is medicine. However, this case is a psychiatry, mini mental state examination. As I told you, my history is only 5 questions and that's it. Then I will start by doing what? The mini mental state examination. How will I tell my patient I will do mini mental state examination? How? You need to be different. I will tell my patient, I'm sure that this is a new phrase for you. I will tell my patient, Mr. Andrew, I have been asked to do an assessment to check how well you remember things, to check how well you memory. Yeah? Please bear with me. Some of the questions may sound quite odd or silly questions, but please, it's a part of my consultation. Why do I need to signpost before I start my mini mental state examination? Because I don't know yet the severity of his confusion. And this patient, in a minute now, I will be asking him, do you know which city are we in? Do you know what is the day? Do you know what is? So some of them may sound silly to him. Some of them might sound silly. So I am signposting. It will look very nice. It will look great. It will look fantastic. You see, that's why I made a separate go-to meeting. You remember the old course? I used to make one go-to meeting for everyone. Now I do go-to meeting for the online doctors, very nice and quiet and cute, and go-to meeting to the other doctors. Once the mic is open and it's disturbing, you switch off, as if it didn't happen. So please, always signpost. Clear? How would we signpost? Mr. Andrew? I've been asked to do an assessment to check how well you remember, or how good your memory is, or how well you remember things. Some of the questions, Mr. Andrew, may sound quite silly or odd, but please bear with me. It's a part of my consult. Is it important? Nice. It will make you look nice. How many people will say that in this station? Clear. Even though it's confused, even though his cognition is gone. However, you need to be nice. Then I will start by doing the mental state examination. Some doctors said, will we have the form in the cubicle? No. You're not going to have the form in the cubicle. No. You're not going to have the form in the cubicle. Okay? All right? You are not going to have the form in the cubicle. You need to know them by heart. You will have a paper. And that's it. Clear. However, if it's there and you are lucky, use it. But it's not going to be there. Clear. But is it difficult assessment? It is horrible assessment. Horrible means tough assessment. Okay. Has anybody watched this assessment before in the course?
We have. Yes, I have.
Now live, huh? She did. Okay, guys, I will tell you now the assessment in a very easy way. Okay, the assessment is 3 words. How many words?
3 words.
First of all, the assessment is out of 30. So the assessment is 3 words. 3 words I want you to remember. That's it. 3 words. in the many mental state examination. Are you lost? I want you to remember the first word is place. The second word is time. The third word is, all of us have passed English exam, yeah? Which English exam did you pass? I passed the OET, Mickey Mouse exam. Which exam? Anybody passed the IELTS? Oh, I will never forget that he passed the IELTS. Yeah? So, OET. OET? Yeah, 3 words. Place, time, OET. Place, time, OET. What do you mean by that? I will tell you now. So, if you remember these 3 words, you will know the structure. Place, time, OET. OET exam, huh? That's the exam that we did in order to come to UK. When they used to do IELTS, lab doctors were like very, very few, handful, like 10 doctors, and the exam was like, lab 2 exam was like 20 stations, all of it, all the lab 20. But after they did OET, it's like a pipe of doctors opened. So OET exam. So place, time, OET. And out of OET, what are the assessments? How do they assess us in OET? Reading, speaking, writing, listening. That's it. So OET here will be speaking, reading, writing, and listening. Are you following? And this is my structure. So place, time, OET. Out of OET, speaking, reading, writing, and listening. All right. Place, 5 questions. That's it. 5 questions. Write number 5. Time. Write number 5. 5 questions. And when I say place, guys, I'm trying to break the structure down. Yeah. We're gonna finish soon now. Place number 5. 5 questions. Time.
5 questions.
OET. Reading, speaking, writing, listening. Anybody else? Has anybody did anything else in OET? It's just this, yeah? Okay. So place. Place from big to small. Again, from big to small. So country. All right. County. Okay. City. All right. Street. Okay. Building. Again. So in the place, I need 5 questions. Big to small. Country. County. City. Street. Building. صح ولا إيه؟ Or building, street, city, county, country. Yeah, so big to small. That's it. Yeah, brother, yeah, brother, yeah, brother. 5 questions. Do you know which country are we in? Number 1. Do you know which county are we in? Number 2. Do you know which city are we in? Number 3. Do you know which street are we in? Number 4. And the building are we in, or the floor that we are in? It's fine. Clear? Now we are all confused. We are all confused. Which county are we in?
UK.
Huh?
UK.
Merseyside, guys, or Greater Manchester. So the county is like the governorate, like Liverpool, St. Helens, 3-4 cities, they became like a county. So Greater Manchester is a county. Merseyside is a county. Okay? Don't worry, he will not know. Okay? So don't worry, he will not know. Just, you know, the counties like in Egypt, there is like 3, 4, 5, 6 city villages became Bahira. 3, 4, 5, 6 Munufaya. You know, I don't know about India county, but you know now. County is like a
Province.
huh?
Province.
Prominence.
Province.
What?
Province.
Province. That's IELTS or ET? Of course, a province, you know, like. Yeah. So 5 questions with the time. So the time, 5 questions. Again, big to small. Big to small. Year. Okay. Then go down. Season. Then go down. Month. Then go down. Day and date. So again, year. Season. Month. Day and date. Are you following me? Yes. 5 questions. And finally, we are left with OET, speaking, reading, writing, listening. So in the OET part, I have 3 assessment speaking, 2 assessment reading, 2 assessment writing, 2 assessment listening. So 3 assessment about speaking, 3 assessment about reading, 3 speaking, 2 reading, 2 writing, 2 listening. And from the name of it, what do you think the speaking assessment will be? Guys, by the way, don't tell the patient, and now I will assess OET. OET is my way, is not in the assessment. You will ask right away the question that I will tell you now, just in case you think that seriously. So OET is just for us. Speaking, brother, no, just for us. You will need the question that you will remember easy through this structure. Okay, so speaking. The meaning of speaking that the patient will talk. So if the patient doesn't talk, it's not speaking. Listening. The patient will listen to you and do something. Writing, he will write. Reading, he will. Are you clear now? So actually, that's why I called it. I split it like this, so it's easy for you. So speaking, I will tell how many questions I said, or how many tasks? 3. So 3 tasks in the speaking. So I will tell my patient, don't ask me how I came out with this structure, because when I was studying, my main concern is to make things easy. So it's not just how to make this easy with this like crazy stuff, like, you know. So speaking, I will let the patient speak 3 questions. No, I'm talking about it's 3 words, guys. Speaking, I said 3 tasks. So I don't want to be lost. The first task, I will tell the patient, can you please say apple, table, penny? And that's the first task. Apple, table, penny, and that's it. So this is the first task in the 3 tasks. Can you please say apple, table, penny? Guys, 3 words. And the patient will repeat them, will say them after you. Okay. And I will tell him, and please remember it for later, and that's it. Stop. So apple, table, penny, and please remember this, because I'm gonna ask you later about them, and forget about it for now. Yeah. Okay. Apple, table, penny, and apple, table, penny with the Egyptian accent is apple, table, penny. It's all, you know, B. Apple, table, penny. Okay. So 3 points. What do you mean 3 points? So by the way, how many places? We said 5 places, 1 point each. What do you mean? 5 questions. If he answered only 1, so 1 out of 5. Are you lost? No. Time. How many questions? 5. If he say the 5 times good, 5 out of 5. If he say 1 out of 5, only 1 out of 5. Now speaking 3 tasks. The first task is yeah brother, say apple, table, penny. And the apple, table, penny is a task. If he say 2 words out of 3, it's 2 out of 3. If he only say apple, and that's it, 1 out of 3. If he said the apple, table, penny, 3 out of 3. What if he said them table, penny, apple? It's okay. It's the same. It's fine. As long as, so the order here is not important. The order is not, as long as he said them. That's the first speaking task, because he spoke. And what did I say at the end? Remember them for? I will tell you when later. It will come later to check is he remembering or not. Okay, but leave it for now. The second speaking task, I will tell him in the room, in this room, in our room, when you have the exam, you will have, I said to you, plain paper, as I told that at the first. I said you'll have plain paper and you'll have pens. Be careful, yeah? You will have plain paper and pens. So be careful, because this, you're gonna write the numbers 1 out of 5, 1 out of 5, 2 out of 5 in this. You have the pen, yeah? So the second task in the speaking, you will tell him, you will hold pen and paper, and you will say, and you will ask him, what is this? He will say, paper. What is this? He will say, pen. So if he say, yeah, this is pen, yes, this is paper, 2 out of 2. If he said, what is this? It's paper. What is this? Paper. So 1 out of 2. Are you lost?
No.
So this is the second task. So the second task, I will show him what? The pen and?
Only 2 things.
Yeah, 2 things. Only 2 things. Pen and paper. What is this? Dr. Paper. What is this? It's a pen. 2 out of 2. What is this? Doctor, it's a pen. What is this? It's a paper. 0 out of 2. Are you lost? So you will just show him 2 objects and ask him to tell you what are these 2 objects. And the 2 objects I'm telling you that will be close to you is the pen and. But please make sure don't give him the pen. Don't say to him, okay, can you tell me what is this? Because if he grab the pen, you're not gonna finish your station. Right? That's your pen. You're gonna write with it. You're gonna finish your assess. Please give me the pen. For the 8 minutes, please give me my pen. I need to finish the station. So don't give him the pen. Just like this. What is this? Is the pen. Because some doctors did. Tell me what is this? He grabbed it. It's a pen. Okay, can you give me my pen? No. Confused about? Seriously. Give me my pen. No, I'm not gonna give you the pen. And then I wanna finish my task, yeah, brother. I wanna finish my task. It's my exam. No, I'm not gonna get. So don't give him the pen. What is this? What is that? And that's it. Clear? What is the third task in the speaking test? Guys, how many tasks you said in speaking?
3.
3. Number 1. Apple table pen. Brother, yeah, brother, repeat. And do we note how many points each paper, each word? 1. Brother, what is this, brother? Paper. What is this? Pen. 2 out of 2. But if he only said one thing, 1 out of 2. If he said nothing, 0. Do you remember when I asked him about Apple table pen? I said to him what? Remember it for? So that's later. The third task. So the third task is the later. I said remember it for later. That's later. Brother, do you remember the 3 words I told you? Apple. 1 out of 3. Apple penny. 2 out of 3. Apple table penny. 3 out of 3. Are you lost? So the third task in the speaking is what I already said to him. I hope I'm making it easy. I hope you are not lost. So I will tell him in the third task, do you remember what I have mentioned to you, what I've asked you early on? Yes, doctor, I remember. You remember the 3 words? Yes, doctor. What are they? Pen, paper, desk. Pen, paper, shoes. 0. Apple table. 2. Apple penny. 2. Apple. 1. So that's the third task. Do you remember the 3 words I have mentioned? Then he will tell you now the speaking is finished. So the speaking basically is around Apple table penny. Remember them for later. What is this? What is that? Can you tell me the 3 words? Clear? Now, the second task is reading. Is what? Is reading. So the second task is reading. And by that I mean the patient will have to read. Simple. So I will write for him. I will write. So the reading, I said how many tasks reading?
2.
I said 2 tasks. So the first task, I will write for him the word world. 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 I will write it. And I will even spell it for him. I will say W-O-R-L-D. And I will ask him to spell it backwards. So the task is him spelling it backwards. Clear?
Yes.
This is his task. So again, how many tasks in the reading? 2 reading tasks. Number 1, I will tell him, I will write for you the word world. And do you spell it for him or not? Spell it, it's fine. As long as you're not going to spell it backward, because backward is his task. It's fine. W-O-R-L-D. And I will ask him, can you please spell it backward? By the way, it's difficult for me, myself. Can you spell? If somebody asks me, spell the word world backward. World, D-L, word, R-O. you know, but it's a task. You don't have to tell it. I mean, so what if the patient said to you DLROW? What will you give him?
Hi.
Again, if he told you, if the patient told you DLROW, how would you give him? 5 out of 5. But if he said to you, listen carefully, DLORW, 2. Why, Dr. Mobat? He said W, the last letter, but he only makes it 2. The moment he makes things up, you stop counting. Clear? So if he said DL, that's 2. Then he started O, that from when he gives you the wrong letter, you stop. And then he only scored 2 out of 5. Online doctors, are you lost?
No, doctor, we're fine.
Perfect. So the word word, spell it backwards. And then you ask him, and then the assessment is out of 5. Okay, that's reading. Did you notice that he's reading? Yeah, that's why I put it under reading. Read, your brother. Read the word and say it to me backward. Okay, what is the second task in reading? The second task in reading, I will use my paper. I will use my paper. So his reading is like writing for me. His reading is like writing for me. What do you mean? The second task for him to read, I will actually write for him. I will write for him. Please close your eyes. Again, what will I write for him? Please, I will write for him on a piece of paper. Yeah, I will write for him. Please close your eyes. Please close your eyes. And then I will look. I will say to him, read it and act and do what I tell you. So he will read. Please close your eyes, and he should do. Clear, guys? He should do that. So if he did this, full 1. If he doesn't close his eyes, 0. So it's only 1. Dr. Mo, I'm confused. Why 1? Why not minimal numbers? Like places 5 times 5. Speaking, everyone is 1 because it's 1 command. Either close or. So if you close his eyes, you give him 1. If he doesn't, 0. But be careful. Be careful because we passed the OET. Be careful because we passed OET. And because we passed the OET, be careful because some doctors, they write for him, please, please close your eye. And the patient will do this. And then you will give him 0. But no, it's you. You understand?
Yeah.
So be careful because Dr. Mo, you know, this station I got low score. Why? Because I told them close your eyes. He closed 1 eye because you told them eye. So please close your eyes, yeah? So now that's the reading. Now come back to that. What is the third task? Writing. So writing, it means that he will write. Writing, it means that he will write. So you will tell him, write a complete, meaningful sentence. Again, can you please write what? A complete, meaningful sentence. Again, he's gonna write. That's why I put it in my structure under writing. So writing tasks. How many tasks I said? 2, because I said to you at the start of the structure, writing is 2. So 2 tasks. So the first task, I will tell him, yeah, can you please write listen carefully, a short, meaningful sentence. Some doctors in the exam, they said to him, can you please write a sentence? And then the patient is dementia, confused, and he took the pen and paper, and they started, he go, dip, brother, please finish quickly. I need to do the rest of my test. So short. What?
Short.
Meaningful sentence. Don't just say, can you write a sentence, yeah, brother? Maybe this guy is, he will write a poem. Abdul Halim Hafiz, very famous Egyptian singer. ابعت لي كلام، قول أي كلام من قلبك أو من ورا قلبك. No. Short. Write down short. I'm giving you special instruction. You tell him, close your eyes. Not close the eye and he will do this and then you will mark him wrong. So no. So close your eyes. When you tell him, please write a short, meaningful sentence. So if he writes a short sentence and has a meaning, you give him full mark. If he doesn't, 0. It's 0 or 1. 0, 1. Yeah? Guys, are you clear? Oh, Dr. Mo, I'm really exhausting my brain in knowing the score. No, guys, don't. Write short, meaningful sentence. It's either meaningful or so 1 or 0. Guys, when I tell him, so that's in the writing. Write short, meaningful sentence. When I tell him apple, table, penny, how many things in the task?
3.
So it's 3. 5 places, it's 5 points. However, if it's a question, yes or no question, like write a short, meaningful sentence. So always remember it's either 0 or
1.
because it's either meaningful or not. So that's the first task in writing. Write, and always remember it's writing. So I will start with write a short, meaningful sentence. That's the first task in writing. What is the second task in writing? What is the second task in writing? The second task in writing, I will draw for him. I will draw something and I'll ask him to copy it. So I will draw for him pentagon. What's pentagon? It's a shape with 5 sides. Guys, 5 sides. 1, 2, 3, 4, 5. That's pentagon. So I will draw 2 pentagon overlapping. What do you mean by that? So the second one is 1, 2, 3 overlapping. So online doctors, that's 2 pentagon. Can you see? 2 pentagon, 5 sides. Yes. 1, 2, 3, 4, 5, and the opposite one, and I will say overlapping, crossing. So I will ask him to copy that. If he does 1, if he doesn't, 0. Clear. So that's the writing test. So how many writing do we have? 2 writing tests. Number 1, I will tell him, can you please write down a short, meaningful sentence? Number 2, can you please copy 2 pentagon? Each one has 5 sides and overlapping in the middle. So if he does 1, if he doesn't, 0. What is the final test?
Listening.
What is the final test? The final test is what?
Listening.
So he has to listen. You will say something and you will see if he's listening or not. Is he able to listen or not? So 2 tasks for listening. Number 1 task for listening, I will tell him, can you please listen to what I'm going to say? Guys, look at my task. Start with the word listen. Can you listen? And in the writing task, can you write? In the reading, can you read word? Are you following? That's why I made them like this, because it's reading, writing. So in listening, I will tell him, can you listen to what I'm going to say and repeat? No ifs, ands, or buts. No, ifs, ifs, ands, ands, it has s. No ifs, ands, or buts, buts. And I'll ask him, listen to me and repeat. If he does 1, if he doesn't, 0. That's it. What is the final task in listening? Because it's a listening task. Let him listen and see what if he listens or not. The second the second listening task, and it is the final task now. I will say to him, can you please? I told you from the start, what do we have in the cubicle? Pens, papers. That's it. Did I say anything else? I will say to him, can you please listen to me and do the command? So he will listen to me and I will check if he listen and do. If he doesn't, so I will say to him, can you please pick? Can you please what? Pick a paper with the dominant, with the right hand, Can you please pick it with the right hand and fold it with both hands and put it in the floor? Dr. Mo, we are confused, Dr. Mo. We are confused. Pick a paper with the right hand, like this. Fold it with both hands. Put it on. That's it. Either he does or not. So can you please pick a paper with the right hand, fold it with both hands, put it on the floor. Are you lost? Zol, Are you lost, Yazoo?
Listening again, please.
The listening is 2 tasks. And both of them will start with the word listen.
To me.
So can you please listen to me and do what? I will tell you. Okay? No ifs, ands, or buts. Repeat. No buts. 0.
I must use that sentence.
Yes. No ifs. Yes, that's what's written everywhere. In HS and everywhere. No, in my hospital, that's what's written. That's the form. Yes. No ifs, ands, or buts. The second one is listen to me and do the command. So can you please pick the paper with the
Right hand.
fold it with,
Both hands.
put it on
Floor.
the floor. Are you lost? No, we finished the mini examination. We finished it. It is difficult, it is tough, but I made it as easy as I can. If you find, if you listen, if you see this anywhere, it's mine, guys. Yeah, because I've done this like 2 years back. The doctor seen it in the course, yeah, 2 years back. So it's in the long course as well. So OET. Maybe some people will change it. Will say to IELTS. Will be some Arabic, you know, whatever. But okay, it's speaking, listening, writing, reading, and always follow the task. And at 6-minute bell, you should start what? Management. So please, I said management with who? Whom with? Examiner. So then at 6-minute bell, you will turn to the examiner and you will give him a provisional diagnosis and you will tell him what you will be doing. Okay? So management is discussed in the online course, in the new online course, in the short course, everywhere. So I don't need to go into what will we do in the management because it's discussed in the course, in the online course. However, I will advise you that when you start the management at 6-minute bell, you should go to the examiner and you should start by telling him, I am suspecting. You are giving him what? Provisional diagnosis. I am suspecting that my patient has, and in these cases, always the patient will have severe cognitive impairment. When I see always, yani, be smart, huh? Yani, okay? So almost. So the patient, what do I mean, doctor, by severe cognitive? It will be less than 10, 8, 6, 7. That means it is severe. So I will start by saying my patient has severe cognitive impairment because my patient scored and give him the score 8 out of 30. Are you lost? Online doctors, I'm counting. This is out of 30. This is out of 30. 99.9% the patient will score less than, and the patient will have severe, not mild, not moderate, severe cognitive impairment. Clear? So,
Dr. Mo,
less than 10, severe. 11 to 19, what? Moderate. 19 to 24, mild. Above 24, 26, 27, normal. Are you lost? But again, 9, 8, 6, 7, whatever, severe cognitive impairment. Because I'm checking his cognition. You remember the first questions? I said 5 cognition questions. Do you know where you are? Do you know what brought you here? So if it's between 10, 11, and 19, it is moderate. If it's over 20 to 24, it's mild. My guys, 20 or 24 means he scored 22 out of 30. Is that good or bad? That's the mild form. If he scored 11 to 19, which means that he only answered half the question, roughly. So that's moderate. But if he's only answered less than 9 questions out of 30, that means it is severe what? Cognitive impairment. That's what I tell the examiner. When I say I'm suspecting that my patient is having severe cognitive impairment as he scored 7 out of 30, 8 out of 30. Are you lost? Okay? Okay. So is it dementia, guys, or is it delirium? Is it what? I don't know about the confusion now. We know there is a cause. Is it dementia or delirium or?
We don't know.
We don't know. Perfect. Well done. Guys, because in the scripts, everybody said dementia. Guys, what is the difference between dementia and delirium?
Acute and chronic.
Perfect. Delirium is acute form. Never had this before. Acute. We call it delirium. Dementia, if he's already have a past history of dementia, and this is an attack. Clear. So he's got past history and it's progressing now, it's increasing. But delirium, no, it's acute confusion. Are you lost? That's why I'm gonna be smart enough to tell my examiner, do you know, is it acute or he's already having dementia? You don't know. That's why you never say. Say, it could be dementia or an acute form of delirium. So I will try to contact his GP. His what?
GB.
And I will check and look for some of his relative, the next of kin, in order to speak to them and know more about his medical condition. Are you lost? Okay, think about it. Think about it, because you cannot give a diagnosis of dementia or delirium because you don't know is it acute or not. You think, because some people say it's dementia. Brother, where in the question mentioned he's suffering of dementia? Is not written, and you did not ask him. So how would you know it could be acute condition? So my point is, do not give exact diagnosis. So always. So again, how will I start my provisional diagnosis? How will I start? I will say
Suspecting.
I am no. I will start for the provisional. I will say my patient scored 8 out of such and such, which means that he's suffering from severe cognitive impairment. It could be due to dementia, or it could be acute form of delirium. So I will contact his GP or the next of kin and talk to them and see what's happening. Clear? And then you manage. Guys, I'm not going to go into management, waste time, because it is in my videos, it is in the short course, it is in the new course, it is everywhere, the management. So I just want to move to something else. Are you clear with this station? So how many questions? History? 5 questions. 5 questions. Confirm your full name, date of birth, do you know where you are, do you know who brought you here, confirm my address. Then I will start the mental step. Before that, I will signpost. I will ask some odd or silly questions, and I will start. Place, 5 questions. Time, 5 questions. And OET is speaking, reading, writing, listening. Speaking is 3 tasks. Apple, table, penny. Remember them, yeah, brother, for later. And then the second task, and then the third task in speaking. Do you remember the 3? Yeah, I remember them. Can you repeat them? Finished. Writing, he will write. When he write, I will ask him write something short, meaningful sentence, yeah, brother. The second writing is copy. Then read. He's gonna read. I will tell him, read, yeah, brother. Read this command. I will write for him. Please close your eyes. And then the second command, and I'll ask him. And then the third, the final is the listening. No ifs, ands, or buts. And the final listening is take a piece of a paper with the right hand, fold it with both hands, put it in the floor, and now I recapped it in like 1 minute now. Clear? And then when you start at 600 bell, go to the examiner and always say, I suspect that my patient is having severe cognitive impairment because he scored
less than 10.
Okay, type. I want to tell you a trick. If you don't understand it, I will move on right away. But I need you to understand it. It's easy. We know that at 6-minute bell, we need to start management. We know at 6-minute bell, we need to start in management, right? What if at 6-minute bell, I only finished the 20? What do you mean by 20, Dr. Mo? I only finished 20 tasks out of the 30 I will ask. So, but to move to management, I need to give him a score. But I only finished 20 out of 30. Should I carry on and not do management, or should I move on? But what score should I give my examiner? Think about it, guys. 20 out of 30 is 2/3 or 1/3 or what? 20 out of 30 is 2/3. If he scored out of 20, 3. What do you think? What do you think out of 30?
The upper
5, 6.
will be 13, the upper limit.
Yes.
It still will be severe.
It's still severe. Okay, what if he scored out of 20, 10? Out of 20 what? 10. Out of 20 is 10, which means it's 50%. It's what? So out of 30 it will be 15. Are you lost? What if he scored 5 out of 20? What is the percentage? 5 out of 20? 25%. So out of 30, if you think about it, out of 30 will still be severe. Because out of the 20 he scored 5. Out of the 20 he scored
5.
So out of the 10 he should score 2 or 3 because it's 25%. So out of the 10, what's 5 out of 20? 25%. So out of 10 it will be 2, 3. So it will be still 8 out of 30. Online doctors, are you lost or are you okay? I hope you are okay.
Sorry, doctor, one question. Do we check blood pressure and anything else, vitals?
No, no, no. No blood pressure, no medical condition, no family history, no how is your family, no psychosocial, nothing. 5 questions, mini mental state examination section will discuss management with the examiner. All right, guys. Okay, let's move to a station of obesity station. Or before we move to obesity station, yeah, let's talk about obesity, more important. Have you heard about obesity station? Obesity station. Sorry? Very common counseling station, obesity. What do you mean, Dr. Mo, obesity station? Obesity station is about, write down, 32 years old. By the way, they are all important. I'm not wasting anybody's time, I hope. If you, at any time you feel that you want to go, go. I'm not, I'm not offended. Anybody's feeling that he wants to go, we are not sitting in a classroom. Just, do whatever you want. So 32 years old. 32 years old. Layla Olwi. How can I say it in English? Layla Olwi. Is that right in English?
She's
Okay.
Not
huh?
She's not obese.
Wallah, she's not obese. You're right. Wallah, you're right. Yeah. Yeah, now we. Yeah. 32 years old, Layla Olwi, presented to the clinic because she has a concern. She has what? Concern. Talk to her, address his concern. That's a very common condition, very common question, very important condition. A patient who's coming because she has a concern, and her concern will be losing weight. Her concern will be that she wants to lose weight. Okay? She wants surgery. And you are the Mickey Mouse doctor, the FY2 doctor, the Mickey Mouse doctor. Okay, is your job telling her about surgery? Like, we're gonna do bariatric surgery, we're gonna go and open, and you guys, you don't even know. Because
we can't hear you, Dr. Mo.
Yes, we can, doctor.
We do. Maybe there is a problem of your mobile or something.
Okay,
No,
no,
we can
we
hear
have
you.
2 meetings. We have 2 meetings, guys. We have 2 meetings. Guys, can you hear me now?
Yes, we can.
The other meeting, doctors, can you hear me?
Yes.
No, I have a.
Yes,
Perfect. So now this scenario is about a patient who's coming to lose weight. All right. So basically, I will have a chat with her, and we need to know what is the solution of this situation. Let me tell you something very important. Okay. After explaining this station for you, after explaining the whole situation for you, okay, Dr. Muhammad Gamal, you will find out and you will realize. Have you heard about people saying, I've done everything, brother, and I filled the station? Everything has everything, brother. Everything he means, everything he mentioned on his paper, everything he mentioned in his notes. But now, after explaining this obesity station for you, you will find out that you can have 4 or 5 different ways of management. What do you mean, Dr. Mo? Yani, one scenario can be managed in 5 different ways. It can be 5 different cases. Do you get what I'm trying to say? After giving you the scenario, after giving you the station, after explaining it first, you will know that I could go to the exam and have 5 different. When I say different, I mean this patient will be managed different from this, different from that. When you go and read the script, it's only one management. And that's it. No, it's not one management in this case. That's why it keeps coming, because people keep failing the station. Okay. Before I discuss about this scenario, the patient main concern is losing weight. I'm not here to teach a script. I will tell you how to think. For a patient to lose weight, okay, I will give you the script as well after we finish. How would you approach it? But for a patient to lose weight, she must fit criteria. She must fit certain criteria. Okay, the criteria that she's coming and she's asking for surgery. Doctor, I want to lose weight through having. That's her main concern. No, just DESA kind of lifestyle. No, doctor, I need surgery. So for a patient to have surgery, listen carefully. The patient must what? The patient must, number one, try DESA. Tried. What do I mean by tried DESA? She already tried to lose weight through diet, through exercise. If she smokes, stopping smoking. If she drinks alcohol, cut down. Number one. Number two, she must have already, this patient, followed with doctors, and they give her or nutrition specialists, and who gave her the advice, and she compliant. She was compliant with the advice, and they still didn't lose weight. Number two, she should be, guys, I'm giving you now, if you think criteria for having what? Surgery. She should be more than 40 BMI. So her BMI more than 40, or more than 35 with medical conditions like diabetes and high blood pressure, heart attack and stroke. So again, the BMI should be either more than 40 with medical condition or not. No, more than 40, enough. Or if it's more than 35 with what? Medical comorbidity, blood pressure, diabetes, two comorbidity in this case, blood pressure, diabetes, stroke and MI. Okay. What is the third criteria? The third criteria that she should agree with you that after surgery she will need quite long-term follow-up. It's not surgery, have a good day. No, it will need quite long-term follow-up as well as long-term commitment with the lifestyle. Yeah, it doesn't mean that we have done the surgery that do what you want. No, lifestyle. So again, I have mentioned some criteria for any patient who's asking for weight loss surgery. Surgery to lose weight. Number one is more than 40, and that's it. What about Dr. Mo? More than 40 BMI and medical condition. Yeah, it's fine. I'm saying more than 40. With or without medical condition, no problem. But if it's more than 35 BMI, she must have comorbidities, MI and stroke, MI and diabetes, high blood pressure, diabetes. Okay. 3 is agreeing on long-term follow-up and commitment with the lifestyle changes. Are you lost? So, Salah al Nabi. Now I will make many stations. That's why I said what script. I will make many stations now. A patient is coming to lose weight. Okay, a patient is coming to lose weight through surgery, asking for a surgery. Then you take history from her, and she's 35 with no medical conditions. With what? No medical conditions. That's it, just 35 BMI. And have you tried losing weight through following a good diet? And no, doctor. How would you manage her? Yes, dietitian and the nutrition in order to, and give her advice about the diet lifestyle, and tell her that in this case surgery is not fitting the criteria. Clear. What if a patient is coming and she's 35 BMI, no medical condition, and she tried to lose weight through DESA? Do you offer her? You can give her medication, Orlistat and things like this, to decrease the absorption of fat. But do you offer her surgery? Why? Dr. Mo, she tried DESA. Yeah, brother. Yes, yeah, brother. She tried DESA, but she doesn't have comorbidities, so she can carry on with the lifestyle and you can give her medication, like Orlistat. Okay, Dr. Mo, what about a patient who's coming more than 35 and has 2 medical condition? Online doctors, you can use the text. You can text. A patient is coming, BMI is more than 35, 36, and she's having diabetes and high blood pressure. Do you offer her surgery?
Did she try this?
Perfect. Perfect. The doctor, our Libyan neighborhood friends. The doctor said, did she try DESA or not? If she tried lifestyle and it didn't work, and she's more than 35 BMI and she has medical condition, then yes, you offer her. Guys, how many stations I have given you now from one scenario? How many? Seriously, how many now?
Doctor, what if she doesn't want to try these and she just wants to go straight to surgery?
Now it's talking. Now it's your job to tell her, well, there's some criteria. I mean, now the doctor, Dr. Samar Zol from Sudan, said to us, what if she's not fit for surgery, or in other ways, she did not try DESA and she doesn't want to try DESA, and she said, I want surgery. Simple. Why don't you want to try lifestyle? Refusing. She's refusing something. Why don't you want to try lifestyle and then go there? Dr. Mo, I tried. Why? She gave me concern and she's not really happy still. I will talk about risk of surgery. Risks of surgery. Risks of anesthesia and surgery. Does that make sense?
Yes.
The risks of surgery. Guys, I'm just here giving you ideas. Wallah al-Azim, golden. I don't want to just like, here you go. No, I'm giving you, I will give you now how the scenario will go. I will tell you, don't worry, as a hi, this, but at the end, I have given you the olive. The olive. Zatuna, the olive. In Egypt, we say the olive.
Sorry,
Olive means?
which risk I will tell her about the surgery?
Risks of surgery. Anesthesia. Okay, it's a major surgery. Okay, you're going to have a scar. Scare her. If you tell her a scar. Scar in my back. Yeah, you're going to have a scar. Yes, gonna have a, you understand? The scar might be infected. Risk of any surgery. Any problem? Okay, it's an important station, yeah. So let's start by talking about the station. The station will start simply because I know you are still waiting for a script. Small script, small paragraph. Hi, I'm Dr. Fatsal Dab, one of the general doctors here. Can you please confirm your full name and date of birth? My name is Laila Aulwi. Date of birth such and such and such. All right. How can I help you today, Laila? Or how may I address you? You can call me Laila. You can call me Lula. So Lula. So how can I help you today? Lula will tell you, doctor, I need surgery. I need to have surgery, doctor, because I want to lose weight. I don't like my figure. Well, definitely we can help you with that. But is it okay to have a chat in order to be able to establish things in a better way? Guys, the word definitely we can help you, which means, okay, I'm here to help you definitely, but let's talk and see if you are fit for surgery or not. All right, doctor, what is my first question? I will tell her, can you please tell me, have you ever developed, now I'm going to ask about complication of obesity. You understand? She's coming, she say, I'm obese, I want to lose weight. So I want to know now, is there any specific reason? Well, doctor, no, doctor. Okay, have you ever developed heart attack, any weakness in your body, any slurred speech, any headaches? What are the presentations I'm asking about? Complications of obesity. Are you lost? So now I'm asking, why did you come? Maybe she said, I had heart attack, doctor, or I had a stroke, doctor. But if she said, no, I just want to lose weight, so I will still ask about complication of obesity. So, MI, stroke, so I will tell her any weakness anywhere in your body, have you done any chest pain, shortness of breath, headache, like a problem in your vision, all these causes of high cholesterol and the high BMI. Clear, guys? Okay, so I will ask her a logic question, logic. So, have you measured your weight? Yes, doctor. What was your weight? Doctor, my weight was such and such. You will give me out because I don't know. Okay, so can you please walk me through your health? I'm going to ask some questions about your health. And now I will start asking, is this obesity hereditary? Is this obesity a part of a medical condition? What are the medical conditions that can cause obesity or weight? Hypothyroidism, caution, yeah? Maybe a patient on steroids. So these are causes. Maybe she's on medication like what? Steroids. For that, I will ask, are you on any long-term medications? No, doctor. Any medical conditions? No, doctor. So caution, one of the causes. Okay? Apart from the weight, do you have any symptoms? Like, do you feel tired more than normal? Okay? I mean, when people feel, hypothyroidism, they always feel tired, and they always feel the weather, they always feel cold. So do you feel cold or others feel okay? So I'm asking about cause of hypothyroidism. Everything will be negative. What is the last and final thing I want to ask about as a cause of obesity? Family. Anybody in your family has the same condition? No, doctor. So now, if you go back to my history, I said to you, with any problem, I need to ask about the symptoms to diagnose, as well as the risk factor, as well as the complication. Online doctors, do you remember? Do you remember that in Plat 2, we need to ask about the cause and the complications? Guys, chat
Yes.
box, please. Chat box.
Yes, yes.
You remember, I always say, at any history, you need complication and risk factor. That's why I have asked about the risk factor of obesity, which was medication like steroid, medical condition, thyroid issues, any problem in the gland in front of your neck, and I asked about tiredness, clear. And I've asked about the complication like what?
Heart attack.
Heart attack. Remember, Yazon? Have you had any heart attack? Chest pain? Any weakness? Slurred speech? Things like this. So I'm asking about the causes and the complication of obesity. Now I will go to the beautiful part, which is DESA. Yeah, shabab, DESA. This is important here. Ask about the diet, exercise, smoking, and station is finished in terms of history. When I ask about DESA, she will give me bad diet, no exercise. She smokes shisha, double apple, for example. The flavor here doesn't matter. So double apple, cherry, grape and mint, it doesn't matter. Any shisha, okay? So she smokes, she drinks alcohol, no exercise and bad diet. It's causes, clear. So don't forget this. Now I have established everything. But there is a golden question that needs to be asked. I hope I'm not bothering you because I'm not giving you a script. I'm just giving you how to think, yeah? How to think. So when we started the obesity station, we said number one, ask about what brought you. Number two, complication of obesity. Number three, causes of obesity. And finally, I will finish it with DESA, because DESA, I want to know, she wants surgery. Have you tried DESA or not? But be careful, because some doctors, they practice my structure that much that in the mock they tell me, what about your DESA? So I look at them. What do you mean, doctor? Wallahi, they ask me like this. What about? Can you talk to me about your DESA? The patient doesn't know the word DESA. This is us. This is diet, exercise, smoking, alcohol. Yeah. So basically, always, I finished now the history, but there is a golden question I have not asked. Who will tell me that question? Give me a hug. Give me a hug. Give me a hug. Don't. Brother, give me a hug. We all know brothers. Don't worry. COVID friendly academy. Have you tried? That's a very important question, guys, because I want to know. Has she tried losing weight or not? Because I told you, to do surgery, she should have already tried to lose weight through DESA. Because if she didn't try to lose weight through DESA, my first option will be DESA, even if she's fit for surgery. Are you lost? So if a patient is more than 35, she has two medical conditions. Is she fit or not? She's fit, but she did not try DESA. She must try DESA before surgery. Clear? That's why this golden question, doctor, what's your name? Dr. Ahmed, he said I should ask her. When I said to you, what is the most important question? I thought you will take some time, but Dr. Ahmed from Libya, boom. He said to me, ask her, did you try to lose weight or not? Because if she said, yes, I tried this, doctor, and nothing is working, I went to the dietitian, I went to nothing is working, then she's fit for surgery. Clear? Now, I will go to examination. I finished my history. So what should you examine? One thing, tell me important here.
Body mass.
BMI, BM, body mass index. Very important, BMI, body mass index. And this patient, when you counsel her, I will counsel her. I'm not gonna tell you the management of the counseling. I am not going to say now how to manage her. Why wouldn't I say how to manage her? Why did I say now? I'm not gonna tell you.
You told us.
Because I told you already, depending, your brother, on your patient. We are not here to give you script and you go to vomit the script. No. You know the criteria? If the patient didn't try DESA, talk about, that's the management. If the patient is tried DESA and 35, say yes, you will be fit for. No, if she tried DESA and if she is fit for surgery more than 35, and then yes, there is a surgery. The surgery, tell her about the risk factor. You're gonna have a scar, maybe, please understand, maybe infection for surgery, and the surgery will need
To be
commitment for long-term management, and the surgery will need you as well to follow good life. What if she is 35 and she's coming to you, no medical condition, and she is the first time to see a doctor is you, so you'll advise her with diet, exercise. So depending on the station, you know the rules. You know now the rules. Follow it. Check where is the patient and manage. And always this patient, I will check what? I will check what? In this patient, I will do an investigation. Tell me one investigation. Perfect. Dr. Arda. Cholesterol. Dr. Ardra. Cholesterol said you need to check the cholesterol. She's obese.
Yeah.
Cholesterol. This patient, I may prescribe her what? Statin. Guys, this is not written in script, I believe. But please take it. Think about it. Dr. Mo said we need to measure the cholesterol and we need to give her, regardless the weight loss. Am I making any sense? Regardless her weight loss, she will have high cholesterol. And if it's high, I need to start her on. It's not a statin station, but I will tell her we can start your medication for that. I mean, the issue of the obesity and the surgery we've discussed, but this is an extra thing to add. That will check the blood, you know, and in the examination we'll measure the blood pressure. It's all complication of obesity. So in the examination, my blood pressure is a must. Okay. And in the management part, after you talk about the surgery, is she fit or not? And you know now, you are expert now on obesity. We've been discussing obesity for half an hour, so I'm sure you fit for any case of obesity. But at the same time, you will say we'll check your cholesterol and you may be starting on some medication like statin. And this patient as well, you can prescribe her a medication. What medication? Orlistat. Why is that medication? How does it work?
Prevent absorption of
This medication prevent the absorption of fat. However, whenever you mention Orlistat, talk to her about that. Yes, the side effect that it can cause what? Now, how would you say steatoria now? Tell me. Huh?
That is too
Difficult to flush. Floating. It's still floating on the toilet seat, So it's still difficult to flush. Greasy. Sometimes it can be offensive smell. Doctor, it's always offensive smell, doctor. Any stool is offensive smell. You understand? So, guys.
Doctor, I just have a quick question. So if she's a good candidate for surgery, do we give Orlistat while she's awaiting surgery, or we just
No, you don't need. No, you don't need. No. All right, guys. Yes.
If she's fit for surgery, why talk about the side effects?
Guys.
You're not scaring her now.
No, guys. I said that when the doctor was asking me, Dr. Samar, when she said to me now about surgery. But now the doctor is asking a very good question, and this question is very good. It shows that he's never worked in surgery before. والله I'm joking with you يا عم. I'm joking والله. حد شايف حاجة? Nobody's saying anything. I'm joking, making a joke. والله making a joke. The doctor is saying if she's fit for surgery, why should we scare her about the? It's a part of the consent. Any consent, you must walk them through the risk and the benefits. No, in Egypt, maybe we don't do. But in UK, I tell any patient, brother, do you know what you're going for? I'm going for my hip replacement. Yes, we're gonna do this and this, and the risk is this and this, and the benefit is this. And no, it's a consent, a part of the consent form. Are you following me? So the patient signs here a consent with the risk and benefit on it. Clear? But maybe the doctor, لا مش هقول محمد ايه. Maybe the doctor is saying, why should we scare her about surgery if she's fit for? He's talking about the private clinics. Why should I scare her? Why should I tell her? You know, I mean, your belly will be sexy and beautiful. We're gonna close it. We're gonna look. Yeah, I know. We're gonna make it nice, and we're gonna put fionge in the front to be beautiful. So, understand? He's saying, why should we tell her about the risks? And you know. Anyway, so obesity is finished. Guys, I hope it's clear.
Can you ask me about the type of surgery or?
No. I mean, you're not gonna go into, because in order to talk about surgery itself, it's a specialty, guys, and that's not your job. Even you're not gonna consent. An FY2 doctor does not consent. And to consent for a surgery, you must know about. You must have been attended the surgery. You can ask this if you have any friend who works in UK. They tell you, have you attended the surgery before? Have you seen it? I did. Consent. I haven't, because to consent, you must walk me through the risks and the benefit properly. Unless you are in a private clinic in Egypt. That's a different thing. By the way, this is recorded, brother. You made us look bad now. Seriously, this is recorded and they will see it for generations. And now they will know that we don't ask them. Yeah, okay, I know, but still. Sleep gastrectomy, all bariatric surgeries, guys, in order to consent, because that happened with me in the NHS, wallahi. Okay, when I started working, I tried once to consent and they said, have you seen it? I haven't. So don't consent, because to consent, you have to really understand about it in order to explain to that patient the risks and benefits. Not just like you're gonna have an operation, sign. No, okay? So now obesity, I think we have explained it well. Yeah. Now we're gonna, so minimal state is finished, obesity is finished, and now we will talk about knee replacement. Guys, they are all important, yeah? So, again, if you want to go, if anybody wants to go, thinks that they want to leave, you can leave. So, knee replacement. Knee replacement is a case, again, of a patient who's coming. Yeah. Knee replacement is a case of a patient who's coming and she came, that's the scenario, write it down. You know, there is a very important point and nobody reminded me of that. Online doctors.
Back pain and joint pain في البرياتريك.
No, online doctors. What did I miss in the last station? What did something we should have asked about in the last station?
Mood.
Mood.
The mental
No.
status.
Mood.
Yes. Who said 4 P's?
I did.
Who said 4 P's? Who said P4?
I did, Sarah.
Dr. Sarah, when you come, when we see you, inshallah, 100 pounds. Egyptian, huh? Egyptian, Indian, Pakistani, okay? Yes, you said P4, guys. The girl, Laila Alwi, if she at any time, which she will be, yeah, 35, 37, 30, please don't forget P4. Please don't forget P4, because you are offering her surgery, for example, or you're going to be offering her medication or stat. Clear. So always ask a female about her period and if she's pregnant or not. Okay? All the time. And follow our structure, which is, we know the structure. By the way, this looks, I mean, I sound quick going through the obesity, but because even the online doctors, I hope they don't let me down, they have seen the structure. Online doctors, you all watch the structures, yeah?
Yes, sir.
Yes.
So on the structures, we know psychosocial, we know about mood, yeah? because she will be obesity.
Yes.
And in the structure, I always tell you if there is something chronic for a while, always ask about.
How does it affect your life and your
Yes,
mood
how
and
it affecting your life. So our online doctors, they know exactly like you because they had the short course and they know that there is psychosocial if it's a chronic. They know that about the mood. Yeah, how is it affecting your job, your work, your mood, your daily activity, always. And before, don't forget now, coming back to knee replacement. Knee replacement. Knee replacement is a case about a patient who presented 2 years back. Presented what? 2 years back, okay, to the orthopedic department, and she was fit for knee replacement. She was fit for, but she was scared to do the surgery. She was scared to have the operation done, knee replacement, but now she's coming and she's asking you, she said to doctor, I need to have the surgery. Do you understand the question? Dr. Mo, why do you ask us, do we understand the question or not? Why do you say, do we understand the question, or is it important to understand it? Yes, it is important. The question said Yazul that she presented before 2 years back, and she was eligible for knee replacement, and she did not want the surgery. She did not want, but now she's coming because she wants to have knee replacement. Yeah. Why do you tell us understand the question? Because I have some findings before I start.
Is there any risk?
It's like I'm driving my car, and before I start, I will say, guys, I have some stories here before I even take history. Number one, 2 years back, what symptoms? 2 years back, what?
Symptoms.
Number two, why were you worried about surgery back then? You did not want to go through surgery. Why? Number three, what made you come now?
No.
Bismillah ar-Rahman ar-Rahim. 1 minute talking without even preparing anything. Am I making any sense? That's why I said, if you understand the PLAB 2, if you follow your patient, you go to the exam and inshallah, you will score like the result that we put in Facebook, 16 out of 16, 154, 158, 176 out of 180. Guys, understand. I have a patient, the question said to me, this patient is refusing. He refused 2 years back. He was eligible 2 years back, but today he's coming back. So before I start, I can see from my note that you presented to our clinic 2 years back and you were eligible for surgery. What symptoms did you have? And why did you refuse the surgery back then? And now, why did you come now? Anybody think it's not important for us in this session? It is important because what scared her before, you want to know? Maybe she will tell you because I had, for example, PE and I was worried about something, maybe family history of any anesthesia, someone that you understand. You'll have a story here. And after you talk to her, now you will start taking history. You will start taking history. And in this station, I want you to understand the history. Yani, what history should I take? I don't want you to memorize it. I want everybody to look at the station, understand it, move on. What do we do with the knee? With our knees, these joints, what do we do? Mobility. Do we eat with the knee? No, mobility. So number one, I will give you 6 points. If you don't mention anything in the station, but you mention them, full mark. And if you talk, some people, the Dr. Mo, have been talking for 8 minutes and I got low score. Yeah, because it's not about talking. It's about the quality of talking. So number one, I will ask, number one, write down knee joint. That's it. That's the first word. That's the first word, knee joint. That's it. Yeah, I will give you 6 or 7 points. And literally, Dr. Osama, it's 6 or 7 words. And the history is done. So what is number one? Knee joint. What do you mean, Dr. Mo, knee joint? Any pain in the knee? Of course. Yes, doctor, I have knee pain. So under the word knee joint, you're going to have 1 minute history. Yes, I have pain, doctor, in my knee. Socrates of the pain. Which knee? Is it 1 or 2? And are you able to walk? Are you able to walk? You remember any pair compare and ask about the joint, the function of the joint? Knee. So what knee? Doctor, I have pain in my right knee. How severe the pain is? Socrates. Socrates. And what about the other knee? Are you able to walk? That's all under the word knee joint. But can you please write a note in brackets next to the word knee? I said to you how many points I will give. 6 or 7 points. And I've covered my history, but relevant history. So the first word is knee. Dr. Mo, what should we do? It's pain in the knee. And I said in my course all the time, any pair compare and ask about the function. How can I help you? Knee problem, knee pain. Which knee? What about the other knee? And the function, are you able to walk? And I will ask you about Socrates, and I'll ask which knee, and are you able to walk? That's all under knee joint. However, Doctor, what's your name? Your name? Dragon. Dr. Dragon, Caribbean, yeah?
Yes.
From Caribbean, very lovely Caribbean. I haven't been to, but I will go to Caribbean. Very nice. We need to go there, and then we're gonna call Dr. Dragon. Where are you? Come and show us. Where should we go? Huh? But she'll be in UK by then, inshallah. Brother, I'm in UK, brother. Caribbean, I'm in UK. Dr. Dragon, when you ask about the knee joint, when you ask about the pain, listen carefully, because there are criteria for knee replacement, yeah? And the first criteria will come in the knee when you're asking about knee. What do you mean, Dr. Mo? If the knee pain is so severe to affect the mobility, or it's there even at night and at rest, fit for surgery. First criteria. So the first criteria, now I have mentioned it within the word knee joint. I hope I'm giving it in a simple way. So when you ask about the knee, focus on the mobility and is she able to mobile, and the focus on the severity of the pain, and focus on the timing of the pain, because if the pain is at rest, and if the pain is at night, and if the pain is so severe that it's affecting the daily activity, it is the first criteria. It is one of the criteria. It's fitting for. Are you lost? Are you lost? So that's why I said when you ask relevant history, not just random. I'm gonna ask about the knee joint, which knee, other knee, and in the pain I need to know the severity and the timing, because if it's so severe, and if it's even at night, if it's even at rest, if it's affecting the mobility, she is fit for surgery. Number 2 words. Number 2 word. The second thing I will have, I will ask about, which is very important, very, 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 very important, and nobody asks. Nobody asks. Very important, not only in the knee, hip, foot, any joint. Any joint. The second point here that you must ask, how goes your mobility? What do you mean? What do you mean, how's the mobility? Do you have any aid? Do you walk without aid? How far do you walk? You understand? I want to know about her mobility. Dr. Mo, why do I need to know about the mobility? Guys, when I say the mobility, I mean naturally. Do you go out for shopping? Because mobility affects the type of surgery. Really? Really? Mobility affects the type of surgery. Yes, guys. If I'm doing a hip replacement, for example, I'm doing what? If the patient tells me, doctor, I had a fall and I broke my hip, how is the mobility before the fall? Doctor, I used to go shopping by myself. I never used any aid. I used to walk all the time. I used to walk for an hour every day. This patient, I will do total hip. I will do what? Total hip means I will change the head and the cup. But if the patient said, no, doctor, I was using the Zimmer frame, I couldn't go out before the fracture, yeah? I don't go out. My sister do my shopping for me. So I will do half, hip hemi, just the head. Are you lost? Hemi arthroplasty. That's why I always ask about the mobility before the problem. So I will tell this patient, how is your mobility in general? Do you go out for shopping? How far can you walk? any help. So the mobility, very important. Do you use any aid? Doctor, are you lost? Are you lost? Okay. I always know if you lost or not from your facial expression. Seriously, when you look at someone and he's doing this, that's nice. But when you look at someone doing this, you know, so the patient, even you guys don't need to tell me that I'm not getting you. From your face, I know. So please, number 2 point is asking about the mobility of this patient. And now I'm talking about this case. Which case are we discussing? But what if it's a hip? Guys, I'm giving you a structure here. Same questions. Same questions. Hip, which have other hip pain severity, this, that, you know, then, you know, so hip. But in hip replacement, we only do it if there is fracture. Yeah. Anyway, so this is the second point. The third point, write down. I will give you 6 lines and the session is finished. And you tell yourself before the lecture, and if I had this in the exam, would have I really asked the questions or not? The third type of questions, write down psychosocial. But this is not the psychosocial that we always talk about. What do you mean, Dr. Mo? This is not the psychosocial that you always talk about. We always say, how's things at home? Who do you live with? No. This is more than this. This is how's things at home?
Assessing the house.
Who do you live with? And your house is everything in one floor, like a bungalow. Bungalow is one floor. The bathroom and the kitchen, like back home in Egypt, we all in one floor. Usually flats. But here in UK, it's all houses unless it is a flat or a bungalow house. Bungalow house is like everything on floor. So I will ask here about who live with this person, psychosocial, and I will ask about the living condition, the home. Is it everything in one floor? Is I mean, do you have to climb stairs, guys? Because I'm thinking ahead after surgery. For example, if this patient is over surgery, I want to know, Dr. Summer, are they gonna go upstairs, downstairs? Because sometimes, especially with hip patient and patient who had hip replacement stuff, we will actually send the occupational to change everything and make everything in one. That's why I said be smart, wallahi. This Plap2 is being smart. In every station, I have points. If I cover them full mark, if I talk for half an hour without covering them, so how many of you would have covered this point? Asking about the home condition. Is it a flat? Is it a house? Is it a bungalow? Is everything on one floor or not? Because that will help in the follow-up. When these patients going home, you will do things at home. You will send an occupational to fix things at home. All right. So how many points have we mentioned now? 3. Point number 4. Point number 4. Online doctors. I know it's a boring session. We are talking about you know, obesity and knee replacement and things, but it's important. Important, okay? I hope you are not bored yet. So 1, 2, 3. Point number 4 is DESA, ya brother. DESA. Why DESA? Switch it off. خلاص, their luck. Their luck. They are DESA. Why DESA? Why DESA? Why DESA here is important. 1 second, guys. I'm just gonna send something. Just give me 1 moment. Okay. 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 Why DESA? Why DESA is important in this case? Can anybody tell me? Huh? Yeah, patient compliance. DESA is important in this case because this patient, we will advise her to lose weight because it's a weight-bearing joint. It's a joint
Yeah.
that she uses to walk, and the weight is a factor here. Am I making any sense? So data is important. BMI is important. I ask her, you measure your weight and and how is your diet, and because that will be important for follow-up later on. This lady, she will need to monitor her data and she will need to monitor her weight, because even though we did joint replacement, again, data is important. Anybody has a doubt? If she's still big, and if we don't talk about the weight, because it's a weight bearing joint, and most probably the problem is actually because of the joint. Problem is because of the weight, one of the factors. Okay, so not only that, but also, what is the BMI for knee replacement? The BMI, there's a BMI for knee replacement.
30.
Yeah, 30 or below 30.
30.
Oh,
30 or
30.
below 30. What do you mean, Dr. Mo? What do you mean? God bless you, ya brother. That's what they say in the UK. God bless you. بس احنا بقى مش UK بقى. احنا in Arabic we say رحمكم الله, brother. So, okay. So, why do I need to ask about the weight? Do you measure yourself? What is your weight? Why do I need to ask about data and the BMI? Simply because one of the criteria for surgery, the patient should be less than 30. That's the BMI. What is the first criteria I spoke in the history? Perfect. You remember when I was talking about number 1 point? When I said the knee joint, ask about the pain, because of the pain so severe enough to affect daily activity. If the pain is at rest, if the pain is all the time, if the pain is at night, you will offer surgery. One day, I want, and this is the second criteria. What is the second criteria now?
Is a functional pain?
BMI. Sorry, doctor?
It's functional pain.
Yes, functional. The doctor saying functional pain. Yeah? What is the name of functional pain? Yeah. Which we said about the pain at first. This pain will tell you it's at night, it's during the day, it's not affecting my life. I'm not even moving. The mobility, which I mentioned in the first point about knee joint. But then I said now that BMI should be 30 or below. Guys, please understand the flap too. Why do people fail a station even though they read the script? Oh, Dr. Mo, because we need to understand the station. Because what you said now, if a patient is having high BMI, high what? What should we advise the patient? Guys, DESA. It is a DESA station. DESA? DESA really? It is a DESA station if the patient is having BMI 35. Can you do the surgery? And why? What is the reason that you do not do the surgery? And what is your management here? DESA. Online doctors, do you know what I'm talking about now? Do you know what I'm talking about?
Yes.
Yes.
I'm talking about understanding the station, Doctora Nihal. Understanding the station. That's why I hate script, because one of the patients, I could offer him DESA first. Why? Because the criteria said that the patient has to be less than. So if a patient is 32, can you do surgery? But you will offer first, and after DESA, they can surgery. But if the patient is less than 30, DESA is okay. Everything is fine. The pain is every time at night. The pain is during the day, at rest, affecting the mobility, functional pain. Do you offer surgery? Yes. Now you know what I'm talking about when it comes to management. Dr. Mo, so do you mean that some patients in management are only talk about DESA? Yeah. If the patient is less than over 30, it is DESA management, because the surgery will be offered when he's less than 30. And be careful, because it's quite tricky. It's quite what? What is the trick? One day, I want to give the lecture without shouting. Nobody tells me to shout. Nobody says shout. But one day I am hoping that in the future I will be, guys, today we're going to talk about knee replacement. Knee replacement is, there's two types of knee replacement, So the pain is very important, and also psychosocial. And don't ask about the pain severity. It's very important. I want to be like this. So if anybody has an advice for me to be like this, let me know, because I have tension headache. After the lecture, I have tension headache. Huh? No, that's a BAM. Beta blocker. Beta blocker. One of the guys took beta blocker first time in the exam. First time ever. Took beta blocker in his exam. Yeah? No. What happened?
A lot of them take actually.
No, guys, you shouldn't. You should. No, he failed. No, he failed. Pass. This guy, I have plenty of stories about beta blockers. So don't take it. This guy took beta blocker, but he was so lucky enough that day, Wallah al-Azim, we had about 20 doctors from the academy. Like the 24th exam, and 25th. About 30 doctors from the academy. That. Plenty of doctors, 24th exam. Gone to the GMC. Huh? He spoke to all of them. This doctor was first time beta blocker. And that day it was about 20 doctors from the academy. And they were many of them in the same period and everything. And they told me, they were laughing about it. They told Dr. Mo, such and such in the exam. When they said move on to the next station, we opened the cubicle, we read that it's still there. They move, brother, get out. It's very, seriously. So they say move on to the next station. So then you move on and you start reading. So they read the question for 1.5 and they get in and they're still there. He's not moved with people. That's how laid back he was. He was like 2 minutes delay in his brain. You understand? Another doctor came in the mock and he said, I will try beta blocker first time in the mock in order to know. So he tried the beta blocker in the mock and he came in my station, seriously. And now he wants to build communication with me. So he said, it was 16 years old asking for contraception. Yeah. So he was so, I don't know, it's like he's gonna rape me. He was like, seriously, seriously. He came so close to me because he's taken it first time and he's so relaxed that he came to me and said, well, my name is Dr. Mahmoud, one of the junior doctors here. And he came, wallahi, and he came very close. And you can call me Huda. How can I help you today? Wallahi al-Azim, as I'm saying now. Huda is in Egypt, because you don't know, guys, it is like a nickname for Mahmoud. Mahmoud, we call him Huda. And seriously, it was like this, yeah? Look at his facial. Well, my name is Dr. Mahmoud, one of the junior doctors here. You can call me Huda. How can I help you today? I stopped the station. Mahmoud, you're gonna rape me. If I'm 16 years old, seriously, if I'm 16 years old and you're doing this with me, Mahmoud, come and sit on my lap then. What's up, brother? No, doctor, I took beta blocker. Brother, finish mock. There is no mock today. I'm done, so don't. That one we're mentioning, like, too much relaxation is not good for you. Anyway, so back to the criteria. So we nearly finished, yeah? We nearly finished our history. But I've given you points. But in these points, every point is like 1 minute. Okay? So number 1 point was knee. Ask about the knee. Ask about the pain. And always make sure that this pain, as the doctor said, functional, affecting the mobility, severity, when, how. Then we said talk about the mobility before mobility. Then talk about the psychosocial. Ask about data, BMI, hashtag to lose weight before. And before all of this, I said don't forget to talk about the first part, which was discussion. Why did you come now? Why did you refuse surgery before? Yeah, you remember? Yeah. Okay. So mobility is important in these cases, if it's a hip, if it's a knee, if it's any lower limb joint, because this patient, you are thinking what to expect after surgery and what is his expectation after surgery. That's why I'm asking. Ask about his mobility before the surgery. You understand? And this lady who came 2 years back, there is a trick here. There is a trick. This lady, when you check her BMI, it's 35. What is the BMI? So what is the management here? The management is data, but she will be angry. Desa, but she will be angry. She will be Once you mention, sorry, you are not fit for surgery. And when you ask her, I mean, what's the reason why she's upset? She will tell you because when I came 2 years back, I was fit even with that weight. Would that be my guys? Because the guidelines changed within these 2 years. It used to be 35, and now it's 30, less than 30, but it used to be less than. So then that's your answer. Well, I'm really sorry. I totally understand where you're coming from now. Yes, I know now where you're coming from. It is frustrating. However, the guidelines has changed. That's why I give you this trick now to get you ready. This happened, yes, because the guidelines changed. It was less than 35, now it's less than 30. Now, so what is your management? Is your management one thing or few things? Guys, is your management one thing or you can have different type of management? So some patient you can go for surgery right away, yes or no? If the patient is having the functional pain and if it's less than 30. Some patient, no. I'm going to offer DASA. Doctora, you following, yeah? Do you understand what I'm trying to say now? So is the management the same here? Because when you read the script, it's always one management. And you go, one management. But you don't even know that, no, I could do this with that. I could do this with that. This patient, I will start on DASA. This patient will go for surgery. This patient, when I take history, no, it's not functional pain. The pain is not so severe. You understand? The pain is only in movement for some time, for like, 1 hour. So this patient is not fit for surgery. Clear, guys? However, when you tell the patient, yes, you are fit, for example, if a patient is fit for surgery, and you say, yes, you are fit for surgery, yes, the criteria, you are fitting the criteria, and you will do surgery. Now, you need to talk about some things. Do you understand what I'm saying now? And I will tell you now what to say, and what are the questions, and what to answer. Okay? So the patient is fit for surgery, and they said, yes, you are fit for surgery. So the patient will tell you, what type of surgery, doctor? Okay, you don't decide. Guys, you do not decide types of surgery. However, you will walk him through things, through options, and then it's the consultant decision. Are you lost? But I will tell him. Okay? And now, whenever I do any topic, guys, that's what I use. The NHS, yeah? I print the NHS, and I always use that. Always, this is my thing. I always use the NHS, just in case you have any doubt. So don't discuss it with me. Just keep it to yourself and leave it and say, I'm not going to discuss it. Seriously. Because if you have doubt, sometimes we get into discussions, will take long time, and I'm using the NHS. So if you have a doubt on what I'm saying, just keep it to yourself and don't say it. Okay? So, surgery. The patient will say, doctor, so what kind of surgery can we have, doctor? How many types of knee replacement guys can you give? Can they offer? Total knee replacement or partial, which we call it half knee replacement. Okay? So total knee replacement, in which we tell him simply like this. Even the NHS said it simply, so simple. Look, can you read and raise your voice, please? Read total knee replacement. Read it, guys. Look at the NHS. Even they talk about things in a very simple. Read the total knee replacement. Tell me what they wrote in front of it.
Both sides of your knee joints will be replaced.
That's it. They wrote in the NHS website, both sides of the knee will be replaced. Half knee replacement, one side of the knee will be. That's what the NHS wrote. That's not me. So they are telling you be simple. Doctor, did you see anything like talking about the arteries and the nerves and the kneecap and the patella? No. Total knee replacement. So that's the first concern. So now we are writing the concerns, yeah? So the first question, doctor, what type of surgery? How many surgeries can we give? Total knee replacement. Which what? Both sides of the knee. One knee, yeah? Not knees, yeah? Both sides of the knee will be replaced. What about the other type, doctor? It's called partial. Only one side of the knee will be replaced. Second question. Please, guys, I'm going to give you all the concerns. You need to know it now. As I give, as I say, as you write. Doctor, are there any other options away from surgery? If you have a patient who said any other options away from surgery, how can you answer? Any other options away from knee replacement? Any other options? Huh?
Hmm?
Yes, I tell him, yes, we have alternative options, but the results are not as good as the knee replacement in the long term. What are they, doctor? I don't know. That's what they told me, but I don't know. What are the other options that are not as good as surgery and they are not even good for the long term? Guys, osteotomy. What is osteotomy?
A fusion of the knee.
Yeah, when we say osteotomy, what is osteotomy? Osteotomy is cutting a piece of the bone. So it's cutting some pieces of the bone, okay, to make the bone realigns on one line. That's osteotomy. A simple osteotomy. A piece of. So if there's a, you know, guys, people who have osteoarthritis, they have new bone formation. They like, yeah, what I mean, they clean it, they make it all in one line. So
they shave it off.
They shave it off. So it's called osteotomy. It's cutting, it's shaving off some of the bones and making all the bones align. Okay. What other option? Arthroscopy. What is arthroscopy?
It's a procedure where you
yes, it's a procedure through which it's like a camera test. Yeah, camera procedure. Tell him like camera procedure. Okay, where we start or where we try to wash out the joint. Okay, and clear any pieces of cartilage or bones. That's it. As simple as that. Let's move to the second concern. Yeah, to clean, to shave, to clean some of the bones or cartilage. Guys, as simple as I'm saying it. NHS. Okay. What is the third question or the third concern? Doctor, for how long I'm gonna be staying in the hospital? I will tell him it's 3 to 5 days if everything goes smooth and well. So 3 to 5 days if everything goes smooth and well. However, once you are discharged, you will need to follow up with us as well as physiotherapists who will give you exercises on how to improve the pain and how to improve the mobility. Again, doctor, for how long I'm gonna be staying in the hospital? How long?
3 to 5 days.
3 to 5 days if everything goes well and smooth. However, when you go home, you will follow up with us. Also, you will be under follow up from physiotherapists who will give you exercise about how to improve the mobility. Doctor, when I go home, will I be able to move freely? You will use aid, frame, crutches. At first, for about 6 weeks after surgery. So when he goes home, do you think he will move right away? No, he will use crutches, aids, for how long? So Zimmer frame for how long? Around 6 weeks after surgery. Now, coming back to the concern that you will be asked all the time. Any surgery in PLAB 2?
Complications.
No. Any surgery in PLAB 2, you find a female 80 years old. How old? 80. 80 years old, yeah? It's a station. It's a scenario. Coming for hip replacement. Coming for? Yeah, no, hip replacement. Hip fracture. And when you tell her what's your main concern, when can I have sex after surgery? يا حاجة احنا بنقوله يا رب ان شاء الله. يعني احنا بنقوله you are going for surgery. Seriously, you are going for surgery. You're gonna be under anesthesia. That's back home, no here. You're gonna be under anesthesia, and we need you to be well, and we are worried about you. You ask about sex. يعني that's your main concern. Yeah, guys, any surgery. If you don't get asked about sex, trust me, I will give you £100. So they always ask, no, here is sterling. 100 sterling. Any patient at any surgery, when you study any surgery, they have to ask you about driving and sex. Doctor, any surgery, any hip replacement, knee replacement, if a patient's having ovarian cysts, any surgery, here, hernia, you know, ya hagga, 80 years old, hip replacement, and why are you thinking about sex now? You know, sex. Yeah, it's a concern. When can I have sex, doctor? So please be ready for these questions. Okay, and please don't say, oh, sex, really? You know, don't show this expression, you know, because yes, she will be old. Yes, she will have a fracture. It's a case. And yes, she'll ask you about when can I have sex, and you need to be ready for it. Okay, boys, remind me after the session, okay, to tell you about a trick. I made a trick to myself when I was studying. When I was studying for Plateau, I made a trick that reminded me about all surgeries timelines. When can they drive? When can they have sex? Okay, when can they do everything? If it's laparoscopy, the timing. If it's open surgery, the timing. But it's not suitable to tell it to girls, because you know, when you study by yourself, sometimes you make things like how I make structures. I made one line, literally. It is one line that consists of 5, 6, 7 words. Literally, it's one line that will tell you about the timing for all surgeries, including the open and the laparoscopy. When can she drive? When can she have sex? So remind me, but it's not appropriate to say it online now and females sitting in front of me, because it was a, you know, quite not, you know, appropriate. When I did it for myself, you know, I cannot say it. But then if the ladies ask you, you can tell them, but you tell them, not me. Seriously, seriously. But yeah, it is difficult because you have laparoscopy.
Please
Yeah,
tell us, Dr.
you
Mo.
have.
We're all
Sorry.
adults here. We're all adults here. Please tell.
You see, seriously, he's tricking me. They are adults here, and please tell. And then when you tell, you'll be all over the social
So
Zia.